So Professor Daube, it's the 50th anniversary of Ash Scotland. You had some involvement in the early days. Tell me about what that was like, what was achieved.
Well, first of all, it's such a pleasure to be here and celebrating the 50th anniversary of an organisation that has done so much and I think had an impact not just in Scotland but way beyond nationally and internationally. So in those early days, ASH, Action on Smoking and Health, had been established in London in 1971 and was just starting to sort of get into action. But there was a concern that that was very London-based and that was terrific, but there was a need for something in Scotland where the problem was even greater. So some wonderful people at the Royal College of Physicians of Edinburgh, Sir John Crofton, Sir John Croom, Sir John the Royal Knights in those days, Sir John Brotherston and others, he was the Chief Medical Officer, decided that something had to be done to get the impact across in Scotland and to call for action. So the college initiated the establishment of ASH Scotland. They set it up with offices actually in the college, which of course are very impressive and really got across that the medical establishment was behind this. There was funding from the Scottish office, thanks to Sir John Croom and the first director of the Scottish Health Education Unit, Dr. Alfred Yarrow, and Scottish ASH really got off the ground. Sir John Crofton was a dynamo. His wife, Dr. Eileen Crofton, became the first director, then supported by Alison Hillhouse, who followed her as director, and it started having an impact. It got media coverage about the harms of smoking and about the harms of smoking in Scotland. It got across the evidence and the magnitude of the problem. It found new ways. I mean, later on, things like a report called the Scottish Epidemic, which pioneered the way that you can show local harms as well as national harms. You know, the big numbers that nobody can quite understand. But local harms, they can understand. They talked to politicians. They got Scottish politicians to make an impact in Westminster and really to speak for the need for action. They campaigned to get curbs on tobacco advertising. They pressed for, in those days, non-smoking areas, which of course then hepped up even further when the evidence of the harms of passive smoking came up. So this was really a major campaigning organisation based in Edinburgh, nationally in Scotland. It established smaller committees even across Scotland, and it really was, it was the origins of what's developed into a thriving campaigning organisation now. And in some ways it showed what can be done, it showed the art of the possible. That was complemented by what was then called the Scottish Health Education Unit, and a wonderful director, Dr. David Player, who, even from within government, took on the tobacco industry, exposed a lot of what it was doing, ran really pretty controversial campaigns in those days to draw attention to the harms of smoking, sponsored non-smoking athletes, sponsored the Scottish team to be the only non-smoking team in the World Cup, and so on. So if you go back to those early days, from really nothing much by way of campaigning to a thriving campaigning organisation, the Scottish Health Department wanting to be active on tobacco, and strong media coverage and strong public support, that's what Scottish ASH did in those, it was then the Scottish Committee of ASH did in those early days, and of course later that developed into ASH Scotland as it is now.
Thank you. And we were actually set up because the health messages about tobacco had not been getting through to the public for about 20 years or so, because the industry was suppressing it. So that was part of our role, wasn't it?
That was absolutely part of the role. And, you know, although 1973, it's a long time ago, but that was still nearly 25 years after we had the clear, incontrovertible evidence that smoking kills, from Doll and Hill and Winder and Graham and so on. And the message wasn't getting through. It wasn't getting through in Scotland. Smoking rates were higher and so on. So the industry was incredibly powerful. It was powerful in Scotland because the companies had factories in Scotland, and so they were commercially very powerful and pretty dominant. So you needed a strong voice against that. But you know, when you look back there were some amazing similarities. We've made terrific progress, and I don't think we should ever underestimate the progress we've made. But we're still the largest preventable cause of death and disease, and it's still a monumental global problem, and we still have a powerful industry. So we've made great progress. We've got a long way to go. So when you look back, a lot of differences, but a lot of similarities. You've still got a predatory industry that, if anything, is more cynical than it ever was, because everybody who's come into it now has come into it with the absolute knowledge that what they're doing is going to kill people. So you had a predatory industry then, you have a predatory industry now. You have people linked with the industry, who are opposing any action that will make a difference. You have that now. You had people putting up soft options. And what we know is that partial solutions get partial results and often can be counterproductive. So you had people putting up soft options then, as you have with e-cigarettes and novel products and so on now. You even had the same sort of rhetoric from the industry about producing safer and safe products, and we've learned and so on. We're producing better products for you. In fact, there's even a wonderful quote from the industry overseas about somebody saying we're producing products that are even better for you. We had the rhetoric that talk about safer cigarettes. So we had the low tar fraud, and that was going through the 70s. And interestingly, I think we were all supporting the low tar approach because that's what the evidence seemed to show, until the proper evidence came through that showed that the industry had really been committing a fraud with low tar, filter and all that kind of thing. But in Scotland, as in England, but even more in Scotland, the tobacco industry was marketing or was trying to develop what they called tobacco substitutes. And some of those were being produced in Scotland. There was a huge amount of media coverage about what they called safer cigarettes. Now it turned out that these were just standard cigarettes with a few other things popped in, and they were just as harmful as brands already on the market. But if you look back at the Scottish media in those days, you will see oodles of coverage about tobacco substitutes, safer cigarettes, safe cigarettes. So it did various things. One is it gave people the impression that these products were safe when they're not. But it also distracted attention from the need for action on tobacco. So, over 50 years, not much has changed, because that's what we're getting with e-cigarettes and other novel products. So let me just go back a bit further, though, back to the beginning again, and say what was different then. We can look back and say there's been tremendous progress. What's the same? The challenge is still our largest preventable cause of death and disease, and that's why we need a strong Ash Scotland.
Professor Daube, thank you. We have come a long way, and the industry hasn't changed. Thank you for the reminder, thank you for the inspiration, thank you for coming to Scotland.
Well, thanks for all that you all do.